Vital Signs Part 1. Vital signs are indicators of health status, and it's going to inform us if there is a change in the patient status. It's important to get a baseline reading when the client first comes in, so you have something to compare to later to determine if there is improvement or deterioration in the client. The most frequent measurements are temperature, pulse, blood pressure, respiratory rate, oxygen saturation, and pain. Make sure that you use the appropriate equipment for the task, the size, type, etc. It's extremely important to reassess vital signs when there is a change in client status or if the client reports that something is just not right. Quite often the client will say, I feel lightheaded, or I feel really hot, etc. And this will clue you in that you need to be reassessing vital signs, even if you feel that nothing is wrong. Heat increases with the rate of metabolism of our body. When the body is invaded by pathogens, body temperature is raised to basal metabolic rate, which is BMR. The body temperature is raised. The basal metabolic rate is elevated in an effort to destroy pathogens. The BMR is also affected by thyroid and other hormones. Elevated hormone levels can increase metabolic rate and body temperature. Decreased hormone levels can decrease metabolic rate and body temperature. Some of these would be epinephrine, norepinephrine, testosterone, and you need to understand that men normally have a higher BMR than women do. Other things that can increase body temperature would be voluntary shivering, exercise, age. Newborns can lose heat very rapidly due to large surface to mass ratio, and the elderly can lose heat very quickly due to loss of subcutaneous tissue. Subcutaneous fat levels, hydration, drugs, illness or injury. Our temperature is different depending on where we are in our circadian rhythm. Stress, our environment. We can gain heat through radiation, lose heat through conduction, convection, evaporation. Heat being lost by evaporation can result in 800 mLs of daily water loss. Eating, drinking, mouth breathing can affect oral temperature readings, so you need to keep that in mind when you're taking an oral temperature. Hyperthermia is temperature that is above the normal range. It's also known as a fever, febrile state, and pyrexia. Hypothermia is lowering of the temperature of the entire body. There are several different types of thermometers out there. We have glass thermometers, which are the old-fashioned kind. They should not be used in unconscious, confused, or agitated clients. You have to shake down the contents below the normal range prior to use. The long lines on the scale will indicate 1 degree and the short lines will indicate 2/10 of a degree. Electronic and digital thermometers, you have tympanic, which are those that are taken in the ear. You may have to change settings for pediatric patients, and make sure that you pull the pinna in the right direction. Temporary or temporal artery skin thermometers, where the thermometer is placed on the skin of the forehead and then slides over to the temporal artery. These devices usually come with a one-time use plastic cover or shield cover probe, and readings can be displayed in Fahrenheit or Celsius. There's also oral electronic or digital thermometers. And then you have the disposable thermometers. These are usually a temperature-sensitive tape that is placed on the forehead or the abdomen. They are the least accurate. When you're taking an oral temperature, make sure that you place the temperature or the thermometer tip in the sublingual pocket underneath the tongue. The tongue then should be kept down with the mouth and lips closed. Normal oral temperatures are 96.8 to 100.4 degrees Fahrenheit. Rectal temperatures, which are taken very rarely, you lubricate the probe, insert it 1 to 1.5 inches toward the umbilicus, cleanse the anus and the probe following temperature readings. It is the most accurate temperature reading, and if you're comparing it to oral temperatures, it will usually read 0.9 degrees Fahrenheit higher than an oral temperature. But don't make that adjustment when you're recording your temperature. You record the temperature that you obtained, and then you record how you obtained it. So don't make any adjustments in your readings. Axillary temperatures are placed, the thermometer is placed in the center of the axilla. The arms should be held tightly against the body. Leave the thermometer in place 3 to 8 minutes if it's an oral thermometer, or if it's an electronic thermometer, when the thermometer indicates the reading has been obtained. Axillary temperatures will, in comparison to oral temperatures, are 0.9 degrees Fahrenheit lower. Again, you do not make any adjustments to the reading. You just say it was 97.8 axillary. You just give the site. Several interventions are listed here to reduce fever. The most important thing we need to remember when we're trying to reduce the fever, we don't want the client to begin shivering, because shivering can actually increase body temperature and cause the temperature to go back up. With hypothermia, we really need to be aware of the people who are at risk for hypothermia and why. When we're assessing the pulse, we also need to assess the pulse character. Each heart contraction will push 60 to 70 mLs of blood into the aorta, which is also called the stroke volume. And the stroke volume will affect the strength of the pulse. We normally find the pulse by palpation or auscultation. When you're assessing the pulse, you need to know that normal is 60 to 100 beats per minute. Tachycardia is anything over 100 beats per minute. Bradycardia is anything below 60 beats per minute. A pulse deficit is defined as the difference between the apical and radial rates. Dysrhythmia is an irregular rate or skipped beat. And then you must assess the strength of the pulse. Is it weak and regular, strong and regular, full and bounding? Is it feeble, where it's barely palpable, irregular? Sometimes they'll have strong and weak beats or some skipped beats. And thready. It is usually fairly weak and sometimes is irregular. This is a picture of the pulse points. There are 9 that you will need to assess when you're doing your assessment. The temporal, the carotid, the apical, the brachial, the radial, the femoral, the popliteal, the posterior tibialis, and the dorsalis pedis. Many different things can affect the pulse, and you need to be aware that if you get differences in pulses, that you need to assess symmetrically. Excuse me. If you get a radial pulse that is irregular, assess the radial pulse on the other arm and then assess the apical pulse. You want to make sure that your pulses are being perfused. Make sure that the apical is matching up with the radial. There are times when you will have skipped beats in the radial pulse, but they're not skipped in the apical pulse, and this is what you're needing to assess. So again, be aware of other factors that can affect the pulse and know what you need to do if you get a pulse that is seemingly incorrect or is irregular. Again, make sure that you always reassess another site.